Hey guys, did you know the 2020 census of the Virgin Islands is still happening?
Yes, they was just by my house yesterday.
I hear they really need our help counting the entire population of the Virgin Islands.
Because the information that you give to the census will help our community to receive federal funding over the next 10 years.
I'm not giving a man my personal information.
All your information is confidential.
And is protected by federal law.
Did you know the results will affect how much we receive in federal funding that can be used for schools, roads, healthcare, and so much more?
We're working hard to visit every home and interview every person in the U.S. Virgin Islands.
We comply with local health and CDC guidelines for your safety and ours.
They came to my house and I wasn't home, but they left a note. How do I make sure I'm counted?
You can call them and complete the census over the phone.
It's super quick and super easy. So do the right thing and complete the 2020 census of the U.S. Virgin Islands.
And be counted.
Hey family, it's Reverend Jermaine Mully here. Every Sunday morning, 8:30 a.m., join us as we take a dive and walk through this series, Messages of Hope.
Wash your hands. Hey, you violent, my boy. Well, every time that you get touched, you have to wash up your hands. Put on your mask, practice some distance, stop spread corona. Like, it's Adamo. And on behalf of the Virgin Islands Department of Health, hold it down on all the mass gatherings. Wearing a mask not only protects you, but it protects your loved ones and your community. Like, help stop the spread corona.
Good day. Welcome to the Government House Weekly Press Briefing and COVID-19 update for the week beginning November 9th. I am joined this week by the Director of Immunization from the Department of Health, Ms. Monique Stout, who will provide the PUI update on behalf of Commissioner of Health, Hussein Encarnacion, as well as the latest information on the work being done to develop a COVID-19 vaccine. Before we go over to Director Stout, though, I have some words on our new normal. As you are aware, through our now Through our now 9 months response to the coronavirus pandemic, the government on the Virgin Islands and its COVID-19 task force has implemented certain restrictions to help protect the community and mitigate the spread of the virus. We have introduced a phase structure that defines our pathway to a new normal and have taken steps forward and backward. Today, November 9th, we officially take one of those steps forward on the path to our new normal. As of today, bars and nightclubs may open, but under the following guidelines. Bars may open and operate for seated service only. That means no patrons will be allowed to congregate, stand, or sit around the bar counter area. The serving of alcohol at bar counters is still prohibited. Patrons are allowed to order and be served alcohol at tables in designated seating areas only. And just as a reminder, table seating is limited to no more than 6 persons per table, and those tables have to be 6 feet apart. Allocated seating areas must meet social distancing guidelines. So, as I mentioned, tables must be 6 feet away from each other in these respective establishments. Also, under these guidelines, there will be no sale or distribution of alcohol after the hours of 11 p.m., and patrons must leave the establishment by 12 a.m. midnight. Masks and facial coverings are required in all bars and nightclubs, except when patrons are seated at their designated tables. That means the only time you are not allowed to wear a mask in a bar or nightclub or restaurant is when you are sitting at your designated service area. Every other time, you must have on your mask. The use of pool tables in these establishments is permitted, but you must wear your mask when playing. Hand sanitizers must be accessible to all players, and cue sticks and surrounded areas must be disinfected after each game. As for entertainment, live music, and DJ entertainment is allowed in licensed establishments. Live music or a DJ shall not be prohibited or permitted after 12 midnight, as these establishments are supposed to be closed at that hour. Live bands shall be set up with a space of 10 feet between the band and patrons using social distancing principles. A clear barrier between live music and patrons may be considered, but it is not required. As a reminder, the occupancy in these establishments is limited to 50% or half the regular occupancy capacity set by their business license or fire marshal prior to the COVID-19 pandemic, or 100 customers, whichever is less. So that means if your business license says that the max occupancy for your establishment is 30, then the maximum amount of people that can patronize that business is 15. If your max occupancy is 250, half of that is 125. However, based on the established COVID-19 restrictions, that number will be limited to 100. So even if half your capacity is a number greater than 100, the max occupancy for your establishment will be capped at 100. And lastly, cabarets shall remain closed. So cabarets, gentlemen's clubs, strip clubs are all to remain closed at this current juncture. So that is those are the new guidelines, or the updated guidelines that go into effect today, Monday, November 9th. And I will turn over the briefing to Director Stout to provide the PUI statistics, as well as some information on COVID-19, the work that's being done to develop a COVID-19 vaccine. Director Stout.
Good afternoon, Mr. Mata. Good afternoon, Governor Bryan, my colleagues at the Department of Health, and the listening and viewing audience. Again, my name is Monife Stout, Territorial Director of Immunization for the Department of Health. Today, I will share with you the latest developments regarding influenza and COVID-19 vaccination. As of November 7, 2020, the Department of Health has tested a total of 25,451 persons under investigation, of which 1,405 have tested positive and 24,012 have tested negative. There are currently 37 active cases in the territory, and 1,345 cases have recovered, with 23 fatalities related to COVID-19. From our hospitals, at Juan F. Louis Hospital and Medical Center, there is 1 COVID-positive admission, 0 vented, and at Schneider Regional Medical Center, there is 1 COVID-positive and 0 vented. We continue to work to mitigate the spread of this virus as well as respond to other public health needs. An important public health pearl and fact to know is the development of immunizations has been listed as the first of the top 10 public health achievements of the 20th century. This highlights the life-saving impact and improvement in the quality of life provided by vaccinations. As infectious disease clinicians and researchers continue searching for treatments and cures for COVID-19, the development of a vaccine was launched at the onset of the pandemic as a medical countermeasure to manage the outbreak. Influenza vaccination outreach began in October this year with the onset of the season to ensure vaccine is available to everyone, especially communities who would otherwise have a challenge with accessing vaccine. As mentioned in prior commentary by Department of Health Medical Director and Infectious Disease Specialist Dr. Ty Hunt Caesar, immunity to influenza is crucial to preventing higher rates of death associated with COVID-19 infections. Collectively, the world is presently fighting to stop the alarming death rate from a deadly respiratory virus which can mimic the influenza virus. Therefore, it is imperative to get the flu vaccine to avoid the possibility of co-infections with COVID-19 virus, which may result in worse outcomes if one were also to contact the flu virus. The Center for Disease Control and Prevention will issue an additional supply of influenza vaccine to the territory and across the nation to assist jurisdictions with increased outreach efforts as the influenza season progresses. Outreach efforts will be conducted in designated areas and are open to the public, except for public housing communities and other entities that have requested specific vaccination service for their staff. This week, the Department of Health will administer influenza or flu vaccine on Tuesday, November 10th at the DeCastro Clinic on St. John, Thursday, November 12th at the Marley and Walter Hodge housing communities on St. Croix, and on Friday, November 13th, at the Tutu Park Mall Center Court on St. Thomas. All events will be held from 9 a.m. to 3 p.m. Of course, we advise for persons to visit the Department of Health Community Health Centers at the Schneider Regional Medical Center on St. Thomas and the Estate Richmond Modulars on St. Croix, or visit your private provider. Influenza vaccine is free or may have a nominal fee if one is insured. Please be reminded to bring your immunization card, insurance if you have it, and identification to the outreach events. Now onward to COVID-19 vaccine. It must be stated first that the Virgin Islands Department of Health will abide by guidelines set by the Center for Disease Control and Prevention regarding issuing a vaccine that is vetted and deemed safe by the Food and Drug Administration. A definite date when COVID-19 vaccine will be delivered to the territory is not yet confirmed. However, in the interim, the department is working in partnership with local and federal entities to create a planning cell to meet the federal mandate to have a complete plan to administer the vaccine in place this month. Mass vaccination plans include determining locations, securing healthcare provider participation to administer the vaccine, purchasing equipment and supplies, staffing, data reporting, and figuring out logistics in an effort to maintain public social distancing and safety and avoid vaccine waste. The CDC also provides an interim operational playbook, which includes documents, links, and resources to assist local routine efforts. There are several manufacturers who are creating the COVID-19 vaccine, some of which require specific storage capacities, temperatures, handling, and dose quantities. All of these variables are considered in the planning efforts to receive the vaccine. Dissemination of COVID-19 vaccine will be contingent on jurisdictional resources being in place to receive the type of vaccine that is being allocated and its associated requirements for it to be administered. Vaccination will be conducted in phases to ensure those who are most vulnerable are cared for first, and afterward the wider public and children. This also means the amount of vaccine sent to the territory will be proportioned for each phase. It is projected COVID-19 vaccine may be available as early as this month, then increase through the spring of 2021 for the general population. The first phase encompasses frontline staff or healthcare workers, emergency medical staff, emergency responders, the elderly and those in long-term care facilities, persons with chronic disease and those with pre-existing conditions which may render them most susceptible to contracting COVID-19. The second phase will focus on specific populations or those who may have challenges accessing the vaccine, including behavioral health or the chronic homeless, and Bureau of Corrections, to name a few. Phase 3 will encompass the broader community and children thereafter. Financing for the onset of COVID-19 vaccination and planning is supported by federal funding and technical assistance. To report symptoms or a suspected case of COVID-19, please call 340-712-6299 or 340-776-1519. Thank you for your attention and continue to be safe.
Thank you, Director Stout. And I apologize for mispronouncing your name.
That's fine.
Monife.
Monife, thank you.
So we'll move along with the unemployment status update on the unemployment numbers or the unemployment checks. As of this morning, the Virgin Islands Department of Labor has issued 45,520 unemployment insurance checks, totaling $643,249 to Virgin Islands residents impacted by COVID-19 related job losses. VDAL has also issued 28,068 federal pandemic unemployment compensation payments, totaling just over $43 million. In addition, the department has issued 4,191 pandemic unemployment assistance checks, totaling just over $7 million, and has also issued $2.3 million in pandemic emergency unemployment compensation payments. That means, to date, the Bryan Roach administration has issued a total of 79,109 unemployment benefit payments to Virgin Islands residents, totaling $88,325,104. Moving on to stimulus payments, the Bureau of Internal Revenue has issued another batch of CARES Act stimulus payments to 2,929 residents, totaling $4 million. The Department of Finance expects to begin issuance of those checks tomorrow, Tuesday, November 10th. So that is great news for Virgin Islands residents still awaiting stimulus payments who have applied for them. That means to date, the Bureau of Internal Revenue and the Department of Finance has processed a total of $82,602,604.31 in CARES Act stimulus payments to 50,636 Virgin Islands residents. Just as a reminder, for those of you who have not yet filed your 2018 tax return or Form 1040 for your CARES Act stimulus payment, the deadline to do so is November 21st, 2020. So that's Saturday, November 21st, 2020. The Bureau will continue to make these CARES Act stimulus payments available to residents or continue to pay those out to Virgin Islands residents until December 31st, 2020. We also have an update for you from the Department of Education on the distribution of the virtual learning tools or Chromebooks and other electronic devices for our public school students. The Department of Education has been working tirelessly to ease the burden of virtual learning on teachers, students, and parents. They have been making progress on their efforts to provide the tools our students need to succeed at virtual learning. Commissioner Barry Benjamin and her team have distributed to date more than 1,500 Chromebooks to Virgin Islands public school students. That is 997 in the St. Croix district and 670 in the St. Thomas, St. John district. The Department of Education will distribute a total of 12,000 new Chromebooks territory-wide. In addition to that 12,000, the department has issued over 1,700 devices from their previous inventory. So that's an inventory prior to the inventory that they had amassed as a result of COVID and CARES Act funding. And of that 1,700, 310 have been distributed in the St. Thomas, St. John district, and a total of, give me 1 second here, a total of 1,475 have been distributed in the St. Croix district. As we close this afternoon, I want to give a statement on behalf of Governor Albert Bryan Jr., the Lieutenant Governor, Tregenza A. Roach Esquire, and the entire Bryan Roach administration, and extend our congratulations to President-elect Joseph Biden and Vice President-elect Kamala Harris. As many of you know, the President-elect has a personal connection to the Virgin Islands, particularly the island of St. Croix. When he was Vice President under President Barack Obama, he frequently spent his vacation time during the holidays here on the island of St. Croix. Governor Bryan on Saturday issued a statement calling the election of President-elect Biden and Vice President-elect Kamala Harris a historic and proud moment for Americans across the country and in the U.S. Virgin Islands. The governor stated Saturday, and I quote, "Outside the historical implications of today's election results, the election of Joe Biden and Kamala Harris is cause for celebration for many across this country, and especially for us here in the territory. As an African American with Caribbean roots, Kamala Harris becoming the first woman elected as Vice President of the United States represents a proud moment and sends the message that there are no bounds to what young women of color can achieve. It also inspires again the belief in our democracy, in the belief in the design of our democracy, and that the full promise of America can be achieved when we all have the opportunity to participate. I expect that our nation, under the leadership of Joe Biden and Kamala Harris, will begin the work of repairing the deeply seated divisions in our country that have been exacerbated by the politics over the past few years. For us here locally, a Biden-Harris administration is promising, as President-elect Biden has a personal connection to the U.S. Virgin Islands and understands the issues confronting our community. We consider him our hometown president. We will continue to work diligently with the current administration on our recovery and other federal priorities, and are excited to continue that work with a Biden-Harris administration. And speaking of President-elect Biden's connection to the U.S. Virgin Islands and the limitless possibilities of what women of color can achieve, we congratulate our fellow Virgin Islander, Dr. Marcella Nunez-Smith, on her being named co-chair to President-elect Biden's coronavirus task force. Having one of our very own named to such an important and consequential role is indeed a proud moment for all Virgin Islanders here in the territory. So we congratulate her and her family today with that momentous news. So that concludes our update today. I will take any questions from the media if we have any, and we are being signaled that there aren't any questions. So with that, thank you for your time. Please be safe, wear your mask, enjoy. Have a good day. God bless.